Hello, I'm Dr. Maria Solindro. I'm practicing integrative medicine in Pasadena, California. Today, I'm going to share about diabetes. And the title is Who Can Control or Reverse and Even Cure Diabetic or Diabetes? This metabolic disease does not kill you right away. Most patients are warned by their medical practitioner for a long time before they finally become a diabetic patient. So there are three types of diabetes. One is the type 1 where they actually started when they were younger or juvenile age. They are called juvenile diabetes. And it's when they do not have some insulins or any insulins. Type 2 is your insulins, you have insulins, but not utilize the sugar. The type 3 is gestational diabetes when you are pregnant and the blood sugar rises due to the hormonal imbalance. About 210,000 Americans under the age of 20 are estimated to have diagnosed diabetic type 1. Approximately, it's a quarter percent, 0.25% of the US populations. When we know it is due to lack of insulin or the production of insulin from the Langerhans cells, and eventually some of them do not produce it anymore because either the virus or autoimmune problem or disease kill the Langerhans cells that produce the insulin. Many of them required insulins for the rest of their life. Some patients manage to keep the honeymoon period. Let me explain a little bit. Let me explain about honeymoon period. This is the term when the cells that produce the insulins are still there. And this period can range from 12 months to 13 years. Can we reverse this diabetic type 1? Well, a small percentage of patients reported they went into permanent remission and back to the normal insulins or no insulins problem. That's great, isn't it? But it's a very small percentage. According to CDC or Center of Disease Control and Prevention, total of 34.2 million people have diabetes type 2. That's 10.9%, so almost 11% of US population. The pre-diabetic condition, which is just a few numbers of the HbA1c before they turn to diabetic, the diabetes is 6.5 and above, and this is 5.5 and above. There are 112.2 million people aged 18 through 65 or older have pre-diabetic condition, which is 34.5% of the US population. So when you add these together, it is 50%. So 1 out of 2 people have diabetes or going to have diabetes. Majority of diabetes is type 2, where the insulin is produced but is not working efficiently and unable to keep the blood sugar or the food sugar into the cell or muscles or liver. So they are floating in the blood circulations. Nobody is born with this type, actually. It is the lifestyle and diet over years has changed the insulin sensitivity to make the person diabetic or diabetes. Story of my family is like this. I am from a family where my father and all his siblings became diabetic when they were an adult. One day, my father asked me of what my specialty is. I explained to him how to reverse aging, like using less insulin or medication in diabetic patients. He agreed and followed the program, and in less than 6 months, he reversed his diabetic condition. At the age of 60, he became non diabetic. He passed away at the age of 92 as a non diabetic person. None of his children are diabetes. We are not. And I hope many of us are not. But unfortunately, some of my cousins are still diabetic and they have difficulties in adjusting the diet and the lifestyle. So the CDC, Center of Disease Control and Prevention, and WHO, World Health Organization, presented that diabetes is the seventh leading cause of death globally in the world. In some countries, diabetes can be the eighth or the 10th leading death because of the social economy and because of infection or neonatal death, which is small children or babies, which are very high in those countries and high in statistic as a cause of death. But overall, is seven leading cause of death globally. The good news. The good news is you can prevent or delay type 2 diabetes. If you are at risk, and I'm going to tell you about the risk later, 3 things you can do. Number 1, making a small changes to the way you eat. Small changes helps. Big changes, of course, will help, but it's difficult. It's diet that you have built a habit since you were young. Number 2, increase your physical level of activities. So this one, of course, is called exercise. Keep moving and keep being active will help. Number 3, if those two are not successful, you can get an early treatment, such as taking medication like metformin, which can return the blood sugar to normal level before you get to the complication of diabetes. So make decision and take action. Okay. Now, first you have to recognize your risk. This risk, you do fasting blood sugar, measure your belly fat or BMI, insulin resistant, measure it in a blood test, and HbA1c, hemoglobin A1c. It's for prediction of pre-diabetic, which is good. And if it's higher, then you have a tendency to become a diabetes. And then fasting blood sugar. Fasting blood sugar, you usually get like 8 hours or 10 hours if you're diabetic. And if not, then it's 10 to 12 hours. So eat to win your health and move your body and improve your calorie burning calories and become healthier. For pre-diabetes, which is HbA1c 5.6 until 6.5 in the blood testing. Pre-diabetes is a condition that can lead to type 2 diabetes and heart disease. Your chances go up if you are above 45 years, okay, 45 years or older, And if you are Black, Hispanic, or Latino, American Indian, Asian American, or Pacific Islander, like Samoan, people who live in Hawaii. Or if you have a parent or brother or sister with diabetes, if you are overweight and inactivity physically, if you have high blood pressure or taking medication for blood pressure, if you have cholesterol imbalance, if you have gestational diabetes or diabetes during pregnancy. And one thing is if you have it's actually ovarium cyst, polycystic ovarium disease. Okay, so then the chance is higher. Other risk factor for diabetic type 2 or diabetes type 2 includes two. One, overweight and inactivity. Being overweight can increase your risk of type 2 diabetes and certain type of cancer. Just to let you know, cancer is the third leading of death. Number two is lifestyle, smoking cigarettes and alcohol intake. If you increase these two, the risk of cancer and diabetes type 2 will also increase. So choose healthy option for dairy and meat. Low fat or non-fat dairy products. Choose the fat-free or low-fat, about 1% milk, non-fat yogurt without added sugar, and unflavored almond milk. Or for example of lean meats, the best choices are cuts of meat that are lower in saturated fat and calories. Include fish and seafood, poultry without the skin, and eggs. Most importantly, be sure to watch the portion sizes, low calorie. Now, if you do not want to watch the calorie, the trend now is no carb. If you take away the carb, the simple carbohydrate, you don't have to count calories because the fat is using a different method, not insulin, to create the sugar, and also protein doesn't count here. You get it? Low carb, no calorie count. But if you need to eat whatever you want to eat, then you have to have calorie count, or low calorie will help diabetes. Okay. We have questions. Men and women, are they the same risk? Well, overall, diabetes and cancer are linked, and it occurs more in men. Men have a higher risk of these two, diabetes type 2, than women. What kind of exercise is good for diabetes type 2? This is assuming it's type 2, right? I give you an example. 30 minutes of brisk walking or a similar activity will work. You can even break it down into, let's say, 3 times of 10 minutes walking. Just in case you have problem with your joint, your leg, you cannot walk too far, or you're overweight and you can only walk 10 minutes, then you just make sure you break it down and you do it several times in a day. This is easier to fit your day if you break it down, perhaps. The most important thing here is to keep moving. Another question here. What typical lifestyle has a bad influence? I mention it. Quit smoking, get recommendation for cancer screening if you are smokers. And then preventative screenings are the next one for other diseases. So preventative screening is very common now. Integrative medicine does preventative screening all the time. We do it 2 times a year, or if we're doing something to prevent a condition that is upcoming but is not there, then we check it again every 3 to 4 months. That's the way to go to check if your treatment is helpful. And next question is, what sugar is bad for you? Sugar is bad. So you're looking for sugar substitute, right? Sugar substitute, they are man-made sugar substitute like Splenda, sucralose, and I forgot the name of the other one. Is it's been so long, but the natural one, they are stevia, truvia, or monk fruits that not much study yet, but they have no sugar and no calories for monk fruit, let's say, if they claim, right? And they both are missing the study until now, but those are what you can use for sugar substitute. Okay. Someone wants me to give an example of diabetic diet or diabetes diet. The goal here is to reduce weight and change the calories. That's the goal, overall goals. So, for example, if you choose fruits, then you should look into fruits with low glycemic index. For example, pear, apples, grapes, and don't select, and then all the berries. Okay, all berries are low glycemic. Do not select like banana or papaya or pineapples and raisin, and those are high sugar, especially when fruits are in a form of dried fruits. Number 2, let's say protein. You need protein. You can do fish or grass-fed beef. It's a little bit more expensive than regular one. And the fish, you choose the one that is caught in a deep sea or Atlantic Ocean where there are not that many traffics there. And then for fat, now this is very interesting for diabetes patient. You can eat good fat as much as you want. And, for example, avocado, avocado is fiber with, and you can mix it with prebiotic. Okay. Artichoke with olive oils, extra virgin olive oils is always good. Or you can do dark chocolate with low sugar. Don't do dark chocolate with lots of sugar. So the 80% dark chocolate does not have too much sugar. About grain. Now this is very difficult, isn't it? So you select the low glycemic index grain. You can do sorghum. You can do quinoa, lentil, legumes, chickpeas. So those are all low glycemic index. How about chia seeds and flax seeds? So chia seeds has plenty of DHA, so improve your memory as well. How about low carb oats with high fibers? Okay. The oil you should use is the one that is non-inflammatory, and those are avocado and grapeseed oil. Unsweetened yogurt is okay. And the Mexican likes to eat pork rinds or chicharron. If you look at the plastic bag, and it always says 0 carb and 0 sugar for chicharron. That's for your snack. In September 2020, the Journal of Nutrients has an article by Dr. Carniero and Dr. Lilup. And it's very interesting because they found out that metabolic disturbance and brain function have recently shown to be linked. So, and it's very interesting, right? Because if you are diabetes, then most likely you might have problem with your memory. So that's the reason why you have to make sure you manage your sugar, because the sugar actually scratch the wall of the cardio of the vascular system. And then in our brain there's so many vascular system. And if when the sugar scratch it, it produces like an inflammation, and the inflammation invites the plaque to stay there. And then you develop arteriosclerosis in or avascular brain situations. That is the leading of dementia. The low glycemic index diet in that article for weight management and insulin sensitivity works. Low glycemic index diet. Dr. Sarah Halberg in 2019, she said, basically do low carb. If you do low carb, predominantly eating fat, okay, and then you don't need to count calorie, and your protein, whatever protein you have there, like a fish and meat, it's okay. But the carb, just cut the carb. You reverse diabetes and you reverse other disease, and it's good if you can. It's called keto diet. And it can be proven by checking your urine. And if you found ketone, then you're doing a good job. Low carb, high fat diet does not have to have calorie restriction. So that's the idea. And it reverses diabetes type 2. And other food like Mediterranean diet, they still need calorie restriction, although it's very good and delicious. So, but you still cannot eat too much of those because it comes also with rice and other things. For diabetes, I think the problem now is diet remodeling or modification. So they need a lot of support. So what kind of support? It's all kind, from all different angles. Number one, they need a physician who has the same interest to reverse your diabetes. And they can adjust the medication also. Number two, from the health coach who check your diet. For example, this health coach will tell you which oil and which food that you cannot eat. Number three, the peer support. Patients like to know who are doing this action or along with this program, and are they having a success. So when they share with you their success, the diabetic patient are happy, and then they will follow. High fat, low carb does not have to follow calorie restriction, like I said. So that is the goal today. Now, just remember, we are not curing your diabetes. So let's say you reverse it already. Stay like that for a while. For example, for a year. Let's say my father has a diabetes for 35 years. When I reverse it in 6 months, he couldn't believe the result. And I told my father, you should do the same thing like this forever if you can. And after a year, his weakness is ice cream, eating ice cream. I think it's mocha almond fudge ice cream. And for the whole year, of course, he did not have ice cream. He knows he couldn't have that one. But later on, we try, and it's the same. He did not have to take medication or insulin, and his blood sugar stays the same. You know why? Because he keep doing what he did, like, dieting with less or low glycemic index food, and then supplementation. He's very strong in food supplement. You know me, I give him the Rolls Royce protocol, and he doesn't mind sticking with that supplements. He even show me, like, what is this, a whole full of food supplements. And then, but luckily he can swallow, so I'm very happy and glad that he could do that. But he hasn't been taking medications or insulin for the rest of his life, which is like 35 years later, right? So we are not curing any diabetes, but we are reversing diabetes. If you can reverse your diabetes, you graduate. If you go back to previous diets, they will go back to previous HbA1c, and your diabetes will stay. So before I close, let me see. What good supplement are there for diabetes? A good questions. How can I mix these supplements, right? So I usually personalize them. So in the personalization, or let's say they want to buy a supplement for diabetes, so I individually check my patient and what is their weakness. For example, there are three things here: intake, volume of intake, digestion, and output. So let's say if my patient has constipation, I have to take care of that first. Then I give them supplements such as aloe vera. Okay, in my supplement list, it's called one flush. I said, you take one flush every day until you get it regular every day, because you need to eat, but you need this food, that much food to go out, because your body doesn't need to absorb the whole thing, right? So I take care of the output. One flush, I said more magnesium. Most people have low magnesium, believe me, because it's the soil doesn't have good magnesium, and so the plant or vegetable we eat is less magnesium. So I give magnesium, and also I test their probiotic actually. So I give this an enzyme. Enzyme is the digestion. So I said, take enzyme, magnesium, probiotic. If this doesn't work, take one flask daily until you are regular. Those are the supplements. And then, how about the intake? Now, the problem is some people get used to taking sugar, so they want sugar. Oh, this is not sweet enough. Oh, they put sugar. Or, they cook with sugar, and they drink with sugar, and coffee with sugar all the time. After so many years with sugar, they become diabetic when they're 30, 40, 50s. And then what? All these years, their tongue is used to sugar. So I tell them, what if I can make your taste bud doesn't like sugar? They love it. And so I said, do chromium. Now the picolinate is very famous because it's very inexpensive, right? However, in the study, polynicotinate chromium is 60 times more efficient and effective than picolinate. So don't buy picolinate because the price difference is so small. The polynicotinate, when we sell it, is only like $3 a month supply. Now, I said, take one and take it daily. In fact, initially I said, be generous. Now, if they can afford it, take like twice a day of 400 microgram chromium. Twice a day is 800. I even asked them to take a little more, so they take 1,200 microgram of chromium. And after 3 to 4 or 6 months, they don't like sweets. So there you go. Now you know that they don't like sweet, and they know they don't like sweet. The taste bud changed. My father's taste bud changed too. So basically, you make them not like sugar. But how? Well, the chromium helps to regulate your blood sugar, and then you give also alpha lipoic acid, and cinnamon also help. And when you mix all of these in their body, and of course you adjust their micronutrients when you test their blood for micronutrients, and they also need to make sure the body is not inflamed. So when they have leaky gut, most of them do have that. And so when they have leaky gut, you have to take care of that. So how to take care of leaky gut? Well, we have L-glutamine to line the gut, and they have to avoid all the food that leaks, and you can test that one. I tested using the epigenetic hair testing. So this is the follicle hair where they come out like 26 pages of result, and among them there are results of micronutrients that are lacking, and also the leaky gut food. They list the top 10 of the food that leaks and causing inflammation, because this is causing immunoglobulin G to react. There are other tests also like Genova, immunology will give you that. So there are many supplements, but I give them according to their symptoms. Not everyone get the same thing. All right. So I hope that helps, Dr. Cynthia. Okay. Thank you, Victor. Yes, tomorrow is Chinese New Year. So I'm wearing my Chinese New Year outfit. So we have a dinner tonight to celebrate with the family. I'm very excited to do that. And I don't want to change my YouTube. So I said, let me just present for half an hour, and then we will celebrate tonight. For those who celebrate Chinese New Year, happy Chinese New Year. And may this year bring a lot of changes from last year, of course. And hopefully your family will be happier, and those who still have business will have a good business. And till next week, I'll see you next week. I'm Dr. Maria Cilindro, integrative medicine, practicing in Pasadena, California. Thank you.